Our next topic is Acne Valgaris. Acne vulgaris is also a skin disorder that is very common, mostly caused by a bacterium, Propionobacterium acnes. It is very common in adolescents because of hormonal changes and androgens. That's why it is common in adolescent age group. The lesions of acne vulgaris, they are mostly present on the face, neck, and upper trunk as well. Now, what lead to acne vulgaris? Usually due to hormonal changes or due to unknown etiology, there is follicular epidermal hyperproliferation. So there is the epidermal cells, they hyperproliferate, resulting in the formation of a keratin plug. Now, in the first step, there is formation of the keratin plug. In the second step, this keratin plug, it obstructs the pilosebaceous follicles. So when pilosebaceous follicles, they are obstructed, it leads to the accumulation of the sebaceous secretions and colonization of these obstructed pilosebaceous follicles with anaerobic bacterium, that is Propionobacterium acnes. And then this leads to inflammation and formation of the lesions of the acne vulgaris. So epidermal hyperproliferation and formation of a keratin plug, obstruction of the pilosebaceous follicles, and colonization of these follicles with Propionobacterium acnes and inflammation. Now, acne can be classified into three categories: mild acne, moderate acne, and severe acne. What are the features of mild acne, moderate acne, and severe acne? If only open and closed comedones are present, white and black heads are present, then it is known as mild acne. So comedones is a feature of mild acne. What is moderate acne? Papules and pustules. If papules and pustules are present, then we will label it as moderate acne. And if nodules, pitting, and scarring is present, then we will label it as severe acne. So for mild acne, comedones; for moderate acne, papules and pustules; and for severe acne, nodules, pitting, and scarring. So depending upon the severity of the acne, we can decide the treatment. For mild to moderate acne, we can use a fixed combination of topical benzyl peroxide and topical clindamycin. We have two options for moderate to severe acne. One is topical adapalene and topical benzyl peroxide plus oral doxycycline. So for moderate to severe acne, we need to give oral antibiotics such as oral doxycycline, and along with oral doxycycline, we can prescribe benzyl peroxide and topical adapalene so that resistance in the bacteria against the antibiotic does not occur. So in short, mild acne is treated with topical benzyl peroxide and topical clindamycin. And for moderate to severe acne, we need to include an oral antibiotic along with benzyl peroxide to prevent the antibiotic resistance. So basically, adding topical benzyl peroxide to the antibiotic can reduce the resistance. That's why resistance against the bacteria, that is Propionobacterium acnes. That's the reason we add benzyl peroxide along with oral antibiotics such as oral doxycycline. What are the differential diagnoses of acne vulgaris? Remember one condition, that is acne rosacea. A differential diagnosis of acne vulgaris is acne rosacea. What is acne rosacea? That we are going to discuss in a few minutes. So depending upon the severity of the acne, that is mild, moderate, and severe acne. For mild acne, the presence of comedones, we will label it as mild acne. If the pules and pustules are present, then we will label it as moderate acne, and the severe acne will be nodules, pitting, and scarring is present, then it is severe acne. Management is very simple: oral antibiotic along with benzyl peroxide to prevent antibiotic resistance. Remember that topical and oral antibiotics should not be used in combination. What if acne is what if it's resistant to the treatment, or if the treatment is, or the acne is treatment resistant acne, then the only option that we have is isotretinoin. Oral isotretinoin is used. Remember that oral isotretinoin is never started by a general physician. So if acne is treatment resistant and you want to start isotretinoin or vitamin A analogs, then you will refer the patient to a specialist for further management. Remember that oral isotretinoin is a teratogenic, so a woman in childbearing age should follow double contraception when she is on oral isotretinoin. And we have discussed this point already, that in the treatment of acne, benzyl peroxide is intended to act primarily against which species of bacteria? Propionobacterium. So this was all about acne vulgaris, its classification and its treatment. Is it clear, anyone, or is there any confusion?